Do people experiencing homelessness have equitable access to primary health care?
No.
And you can stop there, right?
That's it. Just no. No, not at all. I mean, there's so many Canadians in general who don't have equitable access to primary health care, particularly people living in rural communities, people living in remote and isolated communities. But homeless people as well can certainly be added to the list of people who have very poor access to primary health care.
Absolutely. Absolutely. We always talk about, how we promote access, but there's so many barriers that are built into the system, and
Yeah.
it becomes challenging. And you've already spoken to the sort of the ongoing chronic illness and the poorer health. I mean, that's a reflection of lack of access to primary care.
Yeah.
So,
There's the intersectionality issues as well in terms of, racism in our healthcare system. And so, well, we know that Indigenous people are overrepresented among homeless people in Canada. And so when you bring together, I mean, there's discrimination against people who might appear to be homeless in our healthcare system. There's discrimination against people who might appear to be substance users in our healthcare system, because they're seen as maybe having drug seeking behavior or those sorts of reasons. So we have all of these reasons that can be tied together. They can be about race. They can be about, the appearance of substance use. They can be about mental health. They can be about developmental disability that might create challenges in terms of advocating for yourself as a healthcare recipient, or advocating for yourself as a patient. And so it's, yes, homeless people have very poor access to primary health care, and then that can be even further complicated by all of these other factors that can be tied together, these intersectional issues.
yeah, for sure.